Sanjeev, every time I read an article about hair loss or somebody asks me about it, the words that keep coming up in various stories about how it affects people talk about it affects people's confidence, hair loss, it affects one's self-esteem, and it makes it sound like people with hair loss are down, not confident, don't want to talk to anybody, and that's all the kind of people we see in here, whereas that's not my experience at all. And there's a whole variety of people, and you get people who are happy doing what they're doing, but they are simply self-conscious about their hair loss, and I think that's the word I think of when somebody asks how does hair loss affect people. I think it makes them self-conscious. Yes, there are people whose confidence is down, but plenty of our patients are simply would rather not be bold, rather than boldness is a major disaster in their life. And I think, take for example, when you came to see me first time, I don't believe it had affected your self-confidence. You are successful doing what you're doing, but perhaps maybe it just was playing on your mind that, is my hair too thin? And you just wanted something done about it. Is that the way you felt about it?
I think that's pretty accurate. Yeah, I mean, I think that it's an interesting thing, isn't it? I mean, before I rang you, I remember thinking, actually, people must be pretty desperate to kind of pick up the phone and go and get a transplant done.
I thought they must in a desperate stage of their hair loss, or
no, a desperate state of mind.
Okay,
that they, that they've kind of, because most people, well, I'm assuming, I mean, I did, wrestle with the idea for so long.
Yeah.
You turn it around in your head and go, shall I ring up? Can I do it? Maybe I shouldn't. I should be tough about it. Let me kind of cut my hair short. Let me change the, you do all of that stuff before you ring up the phone and say, can I have a consultation? Can I have a checkup of some kind? And so the assumption in my head, I think, grew to the point that you must be pretty desperate, in yourself to kind of go, I've exhausted everything else.
Ringing us is the last resort.
It is. It's kind of, there's nowhere to go beyond that. Right. If the surgeon says, no, nothing we can do, that is it. There's nowhere to go. Yeah. And so, and I think that's quite prevalent. And I think that's why a lot of people still are very secretive about, they're, choosing to kind of call somebody.
Yeah.
Because of that, because you're going to go, I don't want to be seen as desperate. So I'm not going to tell my friends, because they'll think I'm desperate. Then they'll be reading all sorts of things into it. How long has he been desperate for? Poor thing. Should we buy him a drink? Actually, if I'd got people to buy me a drink, it would have been fine, but I forgot to do that. But you know what I mean? And
I know what you mean. And in a way, if you do get yourself into that sort of twist, then you do get down about it, and then sort of becomes like a vicious cycle. I mean, I actually much prefer people come to me when they're first starting to think about hair loss, or they think there's an issue, and come and take advice. And we were talking earlier that we turn quite a few people away from having surgery. That doesn't mean we can't help them, because at that point it's just about maintaining your hair loss and stopping the process from getting worse. But I think most of my patients are simply aware about their loss rather than desperate, in a desperate state about it. And I like to give them advice what can happen in the future. And these are the kind of people who should be on maintenance type treatments to kind of stop the process from getting worse. Things like...
Sorry to interrupt you, because I just wanted to say about the maintenance thing. It strikes me that I remember now, there were various stages of hair loss that I was at, where I remember thinking, and possibly even saying to my friends or family, do you know what? If it stops at this level, I'll be fine with it.
Yeah.
And I think I must have done that a few times. I'm sure that maybe other people may have you kind of go, do you know what, it's lightened a bit, it's a little bit kind of thinning here, if it stops here I'll be fine. And so management,
this is exactly what I say to people. So when I discuss these things with them, and somebody comes in and I'm trying to assess, well, what's going to make them happy, And I asked those questions. Look, if I tell you now that what you look like today is the worst that is ever going to happen, would you buy that from me? And and if they say yes, great, you're a happy patient, no need to do anything else.
Something that actually it's something we mentioned before, but let me put it in another way. The number of people, I mean, generally you talk to friends, you even read kind of articles and stuff, and you get the impression that most men are conscious about their hair or losing it, not conscious of having it, conscious of losing it. But there are, and I may have been mistaken in this, and you may know this, but there are statistics out there that tell us what percentage of people actually do something about it.
Yeah, it's actually pretty very surprising. The figures come from the United States, but in the UK it's a little bit more conservative than that. But in the UK, wherever you read, there's a statistic to show that there are 8 million men in the UK with hair loss at any one time, and according to the USA figures, less than 3% of the hair loss population seek treatments.
Of any kind?
Of any kind.
Treatment of any kind?
And less than 1%, and if I remember correctly, the figure was 0.7% are actually having hair transplants. Now, that figure was from maybe a while back, a few years ago. Maybe it's a bit higher, say 1%, even 2% of the men who are losing hair are having hair transplant. It's still a staggeringly low number. And I can only assume the rest of them, I cannot assume that the rest of them are simply don't care about their hair. I think every man would rather have hair than not. The difference is that what are they willing to do about it?